Hi and welcome to This Natural Life. Today we're joined by Nutritionist and Naturopath Kate Johnston from Core Wellbeing. Welcome, Kate.
Thank you.
And today we're going to be talking about the rise of certain sensitivities and intolerances to foods, in particular gluten and dairy. So Kate, can you tell us a little bit about why we're seeing such a rise in these sensitivities and intolerances?
Yeah, so it's definitely that kind of chicken and egg scenario. So one side of it is the gut integrity and how that's setting up these intolerances. So when you think about the gut and the structure of it, you've basically got these tight junctions that will enable small molecules, so nutrients and things that are supposed to get out into the bloodstream to get out, and the larger molecules to stay sort of inside. As we kind of get inflammation and irritation to the gut mucosa with our diet and lifestyle factors, we're basically making those junctions wider and wider, so people are referring to it as leaky gut. And in effect, the larger molecules are then able to seep out into the bloodstream where they're not supposed to be. The body then mounts an immune response because it sees that it's something that could potentially be dangerous, and as a result you set up these intolerances or food sensitivities. It's kind of a progressive thing, so you might have a small amount of exposure and be okay, but a more consistent exposure will create worse symptoms. Definitely gets worse over time. The other side of that is things like gluten and dairy, which are actually just sort of setting up that leaky gut picture to begin with. So dairy, for example, is quite an inflammatory food. The way that we raise our cattle and the way that we then process the milk, so because the cattle are raised in a way that would have a lot of bacteria come through in the milk, we then have to treat it with a lot of heat, so pasteurize it to kill the bacteria. However, that bacteria, even though it's dead, is still present. So the body is still recognizing it to a degree and still mounting an immune response. So we are still getting some sort of irritation and inflammation through the digestive tract. With things like gluten, so gluten is the protein that's contained in wheat and some other grains such as barley, spelt and rye. It's inherently difficult to digest, but then on top of that we grow our grains like wheat, for example, in a way that makes them really sturdy. So it's great in the sense that they can withstand sort of temperature and climate extremes, we can grow them all year round, but how that translates to digestion is it's sturdy on the inside as well. So it's really difficult to break down. The longer something sits around in the digestive tract, again, it's creating that inflammation, irritation. So it's kind of like one comes first and then creates the other and creates the other, and it just keeps on going.
And people are presenting with these sensitivities or intolerances in, I guess, not typical manners as well.
Yeah, so I mean, the obvious thing that people would think of is that you would get gut symptoms. So a lot of people do get sort of bloating, pain, cramping. They can have constipation, diarrhea. However, you can also get symptoms across the whole body. So the way the immune system works, we basically have three types of immune reaction. IgE is when you have that true allergic reaction, so it's that real hypersensitivity. At worst, you're getting anaphylaxis, and down from there you kind of can get things like hives, you can get lip swelling, throat closing over, that kind of true allergic reaction. You then have IgA and IgG mediated responses. So IgA is typically, and I say typically because there's this funny crossover and it's not totally understood yet, but typically affects the mucous membrane, so you get things like respiratory congestion, definitely can still be gut-related issues. And with an IgA response, you get the reaction sort of from immediate exposure up until 7 days post-exposure. With an IgG reaction, it can be from immediate exposure up until 30 days post-exposure, and those antibodies can deposit anywhere in the body. So you can present with things like joint pain, you can get migraines, you can definitely still get that gastric kind of irritation and pain, but it can be a lot more sort of systemic as well.
Right, and so for people who feel like they may be presenting with some of these symptoms or are just interested to know if they do have any of these intolerances, what are the best things that they can do?
Yeah, so I would definitely recommend that you see a practitioner who's going to do a really good food sensitivity test. When I say really good, I mean one that is done in a proper laboratory, so it's a controlled environment, and has the ability to test IgE. If you may not need to test that if you aren't getting that immediate hypersensitivity, but definitely testing IgA and the full cascade of IgG antibodies, so 1 through to 4. A lot of the tests available are only testing IgG4, which is actually only 2 to 3% of the antibodies that are present in the body. On a kind of more at-home level, you can just make sure you're really taking care of that gut mucosa, so maintaining the tight junctions and the integrity. Something that's a really nice thing to do is make like a bone broth, so either from beef or chicken bones, or it can be other bones as well, I suppose. And what that does is gives you a really nice stock or broth that's very rich in gelatin, and that's going to nicely sort of heal and keep things healthy and sealed on the way down.
Great, thanks Kate. And remember guys, if you are interested in any of these food intolerances or sensitivities, make sure you look up your local natural healthcare practitioner. Thanks a lot.